Watery eyes, stuffy nose, sneezing. Kind of describe how you've been feeling lately, maybe. It seems like it could be a common cold, but don't let the symptoms fool you. It could be something more serious like chronic sinusitis. Joining me now to tell the difference is Dr. Kalpana De Pasquale and patient Tammy McConnell. Thank you very much for being here. Do appreciate it. Doctor, if I could start with you first, because there's this new kind of breakthrough treatment that's being used to help treat chronic sinusitis. And I know that we have an example here, which I'll kind of try to hold up. It looks like, I think, well, Bruce described it as a fence earlier, like a fence. But it does kind of look like that it's spring-like.
Correct.
And how does this work, and why is it so successful?
Well, it actually is a spring-like device. I'm going to take it off this little...
Because the green can kind of distract.
Exactly. So this is what it looks like. And we can place this inside the sinus cavities immediately after sinus surgery. And what it does is it has a steroid within it. And what it does is it reduces postoperative inflammation, reduces postoperative scarring, and also allows patients to avoid things like oral steroids, which have their own set of side effects, and also reduce the amount of procedures they may need in the future.
Now, Tammy, I know that you decided to have this, so it basically goes in, then it springs apart, right?
Yes, it's actually within a little device, so we use that device to put it up into the sinus.
And Tammy, give us a little bit of your background. I mean, you're busy, you're a mom, you know, OR nurse, you have triplets at home. You don't have time to slow down because you constantly are feeling bad. And a sinus infection is terrible because you feel that pressure on your eyes and nose.
Right, constant headaches. Dr. D actually told me about 2 years ago I needed the sinus surgery. I put it off because I was intimidated by the recovery, of the days of packing and debridement and just weeks of being incapacitated. And so I went back finally 2 years later. The headaches had gotten too bad and I just couldn't handle it. The day I woke up from surgery, I had less pain than I'd had in 2 years. I could breathe. There was no stuffiness. The recovery was just a few days. Pain was totally manageable. The recovery was very easy.
Which is key, too, so that you can get back up on your feet and chasing around those 7-year-olds, right? Those three. Any side effects to this, and is it permanent, or do you have to frequently replace this?
You do not have to replace it. It will dissolve in a matter of several weeks. Really no complications. The FDA actually cleared this device in 2011. It's been deemed to be safe. It's effective. The only thing that can happen, sometimes people will get a little bit of crusting around the device, but that's easily removable in the office, and that's pretty much it.
So if it dissolves, then does this solve the problem of chronic sinusitis, or is it something that you might have to have the procedure again in a couple of years if it doesn't last?
Pretty much, you can't really predict what happens, but, when we do sinus surgery for polyps specifically is where I use this, those people always have a chance to reform polyps. So what we can do medically is avoid that as much as possible, avoid recurrent surgeries just by placing this device in. It bathes the sinus cavity in a steroid. That way we don't have to use oral steroids as much. So I would say it reduces the frequency. I don't know if we can say for sure that it avoids it altogether or cures it, but we can certainly reduce, improve, and make patient outcomes better.
But even just long-lasting relief, even for a year or two or a couple of years, is certainly worth it if you've ever had a sinus infection.
Absolutely.
Let's talk a little bit about the difference, because it is kind of cold and flu season as it is now. How does someone sitting at home and they're kind of stuffy, how do they know the difference between just a common cold and something that's more serious that they might need an antibiotic for?
Well, the common cold it's really the duration of symptoms that we would know from. So a common cold will last a couple of days to about a week. People will tend to see some improvement within a couple of days and will improve with supportive therapy, antihistamines, nasal sprays, et cetera, et cetera. When you have an acute sinus infection, the symptoms are typically a little more severe. You won't see that progressive improvement over the couple of days. It may last a week to 2 weeks. You'll have thicker discharge. It may be associated with fever. You generally feel much worse when you actually have a sinus infection. So that's the big way we tell the difference. And then chronic sinusitis is any symptoms that last greater than 3 months. So patients may have facial pressure, they may have nasal congestion, nasal obstruction, fatigue, and sometimes from all these symptoms they typically can have depression even.
Oh yeah, I know. If you're constantly feeling bad every morning when you get up and it never gets better, I can see how that would happen. Doctor, thank you for being here.
Thank you so much for having us.
Tammy, I'm glad it's going better.
Thank
Good luck
you.
with the triplets.
Thank you
appreciate
very
you
much.
coming on this morning. And of course, don't forget you can keep up with the latest health headlines on news4jax.com. Just click the health page on the home page.